Steady on your feet. That's the name of this show, and that's our goal for you. We hope today that we're going to give you a lot of information about balance and specifically vestibular problems and other ways that they can affect you and to keep you safe. It is not a typical thing of aging to start to have balance problems, and McLean Rehab can really help you. So we welcome you, and we're going to start with vestibular program. So what's that mean, Eric?
Thanks, Freddie. Hi, my name is Eric Tharaldson. I'm a physical therapist here at McLean in our outpatient department. I specialize in vestibular therapy, and today I'm going to talk a little bit about our vestibular therapy program here.
So Eric, what does vestibular really mean?
Well, vestibular can be considered the balance center of the inner ear. The vestibular system's function is to provide information to the brain about our head position and head motion. The vestibular system works together with our vision and our somatosensory system, which are our joint receptors, and they provide information about where we are in space. It helps keep us balanced and upright.
So what happens to someone when they have a vestibular program? What do they feel?
That's a good question. The vestibular system, when it's working correctly along with the other systems, we're fine. But when something happens to the vestibular system and it's not functioning properly, we get a kind of a wrong signal to the brain. The brain, as I just said, works with our vision and our somatosensory system together. So when one is off, we can feel symptoms such as vertigo or dizziness. You can feel lightheaded, nausea, feeling of fatigue, all variety of symptoms.
So what can cause disruption in your vestibular program?
There are a variety of disorders that can cause problems to our vestibular system. I want to start with the two main problems that we see here in therapy for our vestibular program. The first one being a viral infection. Classic case would be somebody would wake up one morning and the room is spinning, they might be nauseous, they're very sick. This could last for hours. It might be followed by a trip to the emergency room, maybe some medication prescribed. A few days later, things will get better, but they still feel a little bit of imbalance. The second common type we see in the clinic is caused by actually a crystal in our inner ear. This usually manifests in quick spells of vertigo. Usually somebody would say, every time I roll to the left in bed, the room spins, or every time I bend over to brush my teeth or put my head back, say at the hair salon, they get quick bouts of vertigo. Other conditions we also see would be somebody with a stroke, maybe somebody with Meniere's disease. As we get older, it could just degenerate. We see that a lot, a head trauma, inner ear concussion. So there's really a variety of disorders that can lead to vertigo and vestibular problems.
So if someone has vertigo, or they think they might have vertigo, or they certainly have balance problems and dizziness, what do they do?
Well, the first thing you want to do is call your doctor, make an appointment to see your doctor, because some of those symptoms I mentioned aren't exclusive to a vestibular problem. So you'll see your doctor. He can rule out some more serious conditions, maybe some cardiac problems or a tumor in the brain, and if he concludes that it is the vestibular system, he'll write you a referral for physical therapy in a vestibular program.
And so if someone comes to our Steady on Your Feet Balanced Vestibular program here at McLean, what do?
We'll do an evaluation on the first day, and the evaluation is very important. We'll spend an hour evaluating that person. The evaluation can be broken up into three pieces, really. The first part is the history, and the history is very important because we really want to get an idea of what is causing the symptoms. Like I said, for different causes, there are different treatments. So we'll spend a lot of time with the history, talk about medications. For example, somebody with vertigo will ask, how long does the vertigo last? How often do you get it? A variety of questions through the history will give us a good idea. And then the next part is our examination. And our examination actually deals a lot with our eyes. It's very interesting. There is a connection between our inner ear and our eyes. And we have some infrared goggles. I'll get these back here. That, for instance, we use. It has a camera inside this where we can videotape our eyes. And for instance, there's a disorder we talked about, positional vertigo, where the eyes twitch up and down, side to side, and turn different directions depending on what part of the inner ear is affected. So we have 3 canals, and depending on where that debris is, the eyes are going to do a specific thing. So that helps us give us some information going forward to set up a treatment plan. The next part we really want to look at is balance. Most people that have an inner ear disorder are going to have balance problems. And we actually have a balance master that can help us assess balance. And actually we'll look at the different things we talked about. Look at, is it a vestibular deficit? Is it that somatosensory deficit? Or is it vision? And we can kind of get an idea which is affected the most.
So once you take this history and you use all your technical equipment to assess them, how do you cure them?
Well, again, that's why it's very important to do a good evaluation, because there's different treatments for different causes. So we'll look at that person, decide what it is, and set up a treatment plan. That person we talked about earlier with the viral infection is going to be more of an exercise-based program. We use a lot of visual things, letters, focusing on things on the wall, moving the head. We're trying to get the brain to actually adapt to a poor functioning inner ear, and that'll help the person balance. When they turn, they'll be more steady. It'll help them get back, on their feet. The second part we talked about, which is the positional vertigo, that's more of figuring out where it is, and we're going to take that person, put the goggles on, we're going to position them. As we find out where it is, then we're actually going to roll that crystal out of that semicircular canal, and they shall be instant relief from vertigo. So.
People tell me that they come to see you once or twice, Eric, and that you actually cured them of something they've had for months or years.
That's true. BPPV can be BPPV, which is paroxysmal, BPPV, which is benign paroxysmal positional vertigo. It's a simple matter of getting that crystal out. I actually had a patient once who had it for 40 years, he told me, and he came in one visit, he was all better. So that's that type of treatment, very quick, very rewarding. And
that's the goggles allow you to do that?
The goggles help us identify exactly where the crystal is, and it's very helpful in our assessment.